Hello, I am Dr. Irene Arroyo with Dallas Podiatry Works. I am one of the sports medicine specialists at our practice. Sports injuries, as they relate to your feet and ankles, is such a broad subject. So I am planning on posting several videos in the weeks to come about common foot and ankle sports injuries, symptoms, and how to prevent them. Today, let's focus on ankle instability. Your ankle has ligaments that are like cords that connect the foot bones with the lower leg bones. They stabilize the ankle joint and prevent the ankle from twisting or giving out, called ankle instability. An ankle ligament can overstretch or tear as a result of ankle sprain. An ankle sprain is a very common injury and can range from mild to severe. The ligament, called the anterior talofibular ligament, is part of the lateral collateral ligament complex of the ankle. Its role is to stabilize the talus, which is the small bone that sits between the heel bone, also called the calcaneus, and the two bones of the lower leg, the tibia and fibula. Most common injured ligament is the anterior talofibular ligament, followed by calcaneofibular ligament. There are two subtypes of ankle instability, acute and chronic. Acute instability typically occurs from acute or recent injury. Most common mechanism of injury occurs with forced plantar flexion, meaning rotating the toes downwards away from the leg, and inversion when the ankle is turned inward as the body center of gravity rolls over the ankle. Chronic instability is often due to undertreated acute ankle injuries, leading to persistent pain, recurring sprains, or the ankle giving out. Sometimes symptoms are worse when walking on uneven surfaces or playing sports. Patients with high arches are more predisposed to lateral ankle sprains. Ankle instability is typically diagnosed with a thorough clinical exam. We assess for ligament laxity, which is when the ankle joint is loose or unstable as a result of injury or damage to the ankle ligaments. Instability is typically more easily identified in patients with chronic instability, since the ankle is usually less painful than in the acute setting. X-rays are typically indicated to rule out any bone pathology such as ankle fractures. MRI can also be useful to rule out any other pathology or causes of ankle pain, which may also need to be addressed, such as osteochondral lesions, bone contusions, soft tissue impingement, or tendon tears. About 80% of acute ankle sprains recover with conservative treatment, and the other 20% result onto chronic instability. At Dallas Podiatry Works, we most always start with conservative approach to treatment. We typically recommend a structured functional rehabilitation program consisting of specific exercises guided towards ankle joint strengthening, stretching, proprioception, recovery of balance, and postural control, in conjunction with external splinting or an ankle brace to prevent reoccurring injuries. Anti-inflammatories such as Aleve or ibuprofen may also be indicated in good old-fashioned resting, icing, compression, and elevation. And if conservative treatment fails to alleviate the condition and symptoms, surgical treatment may be indicated depending on the degree of instability. There are several surgical treatment options for addressing injured ligaments, but most common is anatomical repair to restore normal anatomy and joint mechanics. Now, ways to prevent ankle instability. You can use external support, such as a compression anklet or taping. Custom orthotics can also help your feet maintain their proper alignment and range of motion, with the goal to prevent symptoms. Supportive shoe gear is also a good preventive measure, and a shoe should have a thick sole to absorb shock and adequately protect your foot. Be deep enough that the section around the heel holds the shoe onto your foot well, and be made of a material that is stiff enough to provide ankle stability. Thank you for taking the time to learn about ankle instability. We at Dallas Podiatry Works are here to assist in healing your foot and ankle problems so you can go and do the things you love to do. Please call our office if you have any questions and to schedule an appointment.